Are we tired of winning yet? We are hugely winning. We have the best of the best, right? Wrong. That was sarcasm if you didn't catch it. The fact is, we should never have partisan politics playing a role when we're talking about something such as science. But unfortunately, in today's times, Democrats believe in scientists and experts and data, and Republicans instead believe in conspiracy theorists. And right now, that is who we have leading one of the most important agencies in this country. Is a conspiracy theorist, not someone who has an actual resume to get the job done. So why would anyone trust the Republicans on anything, let alone matters of public health and safety? It has taken Texas' largest measles outbreak in 30 years, with more than 500 confirmed cases and the death of 2 children, for the Secretary of the Department of Health and Human Services to say what we already knew. The most effective way to prevent the spread of measles is the MMR vaccine. This is the same guy who chaired the anti-vax nonprofit Children's Health Defense. Just last month, during an interview with Fox News, he suggested that somehow being infected with measles could provide protection against cancer and heart disease. The Republicans are implementing the most dangerous public health agenda in modern American history, and people are literally dying as a result. This administration doesn't believe in science. They're firing thousands of scientists and public health officials who keep our food and medicine safe, slashing funding for scientific agencies that help cities and states respond to public health emergencies, limiting public access to research and data that contradicts their misinformation. They're using financial threats to manipulate which studies the government will sponsor and blocking researchers from diversifying clinical trials. This reckless and chaotic approach will make it more difficult for the FDA to achieve its mission of protecting the public health of Americans. But there are 2 issues that I want to address before my time expires. Staffing at FDA has long been a challenge. The Government Accountability Office has identified several challenges at FDA as high-risk issues. One of the bigger issues the GAO has identified is FDA's extensive workload. Last Congress, the Senate held a hearing on the sale of unauthorized and illegal vaping products and e-cigarettes. During the hearing, Dr. Brian King, director of FDA's Center for Tobacco Products, testified that the volume of pre-market tobacco product applications is overwhelming. So FDA is instead prioritizing its enforcement responsibilities when it comes to e-cigarettes products. But just last week, Trump not only fired the director of FDA's Tobacco Center, he closed 2 entire offices responsible for drafting new tobacco regulations and setting policies. Dr. Kessler, in its 2025 high-risk report, GAO stated that, quote, stable senior FDA and center leadership remains of vital importance to the agency. How will this vacuum of leadership impact the public health and safety of Americans?
It will put Americans at risk. But you, Congresswoman, you raised a very, very important point. I'm the only pediatrician on this panel today, right? And your constituents, please, the most important thing is what you said. If you want to prevent measles, please have your children vaccinated against that very dangerous disease.
Thank you so much for that, Doc. And I only got 56 seconds, and I don't know if I'm going to go through my last question because you just, I'm looking at Greg to see if he's going to make me do it. Listen, I'm going to go off instead. Sorry. I appreciate the fact that you are an expert in this, and here's the reality. The Republicans, and definitely MAGA, loves to troll me in so many ways. And the reality is that I trust and believe experts. I don't believe that I know everything. I believe that I was elected by my constituents to make sure that I could keep them safe in all ways, making sure that they are not going to be victimized if they have, say, family members that are serving abroad because of Signalgate, because of that incompetence, making sure that they have access to vaccines if they need it, making sure that they can actually provide for their family because we have real economists that are
the gentlelady's
deciding
time is
whether or
expired.
not we are
Gentlelady's
engaging-
time.